Many times I get asked, well, what if I've had a history of miscarriage? Am I still okay to be a surrogate? And the answer is yes. I mean, almost all women will have had an early first trimester miscarriage. If you had a second or third trimester miscarriage, when I say second trimester, that's usually months 4, 5, 6, right? Third trimesters later. That's a little bit more concerning because those types of losses are not that common. And it makes one wonder, okay, what happened? What happened in her body to make that happen? Versus first trimester miscarriages, over 50% are not due to the surrogate, the uterus, but rather something was unhealthy about the baby, the embryo. Now, sometimes I get surrogates who've been surrogates before and it didn't work. Well, let's say she had a miscarriage. So is that an automatic exclusion? It's not. So the first question I ask is, okay, so the embryos that were transferred into you, what was the egg source? Was it from a 39-year-old egg source, or was it from an egg donor who's 20-something years old? Because the prognosis for success is vastly different. If it's from an older egg source, it's not uncommon, even though pre-implantation genetic testing was performed, the success rates are not as high as that from a 28-year-old egg donor. Sometimes I'll have surrogates where, yes, these were egg donor embryos, and gosh, the surrogate has had 2 miscarriages. And that's happened to me as well. And I do believe there's a compatibility issue that happens. I can't objectively test it, there's no test for it, but I have seen where for some reason the surrogate's body just does not click well with these set of embryos. But then when that surrogate is then presented to another set of intended parents with a different set of embryos, bam, she gets pregnant. So sometimes it really is a compatibility issue. The important thing, though, is that, again, all parties are aware, that the intended parents are aware that the surrogate had a history of miscarriages, even with egg donor embryos, and that for whatever reason it didn't work. Everything looked perfect, but it just didn't work. And in that case, I tell the intended parents, different set of embryos, let's give this a try and let's see how it goes. So a miscarriage does not necessarily exclude you from being a surrogate. It really depends on the circumstance.